Well, the Environmental Protection Agency has issued a grave warning over worsening air quality this harmattan season as rising dust levels cast a shadow over the festive cheer, with air quality index reading ranging from, quote, unhealthy to very unhealthy, unquote, as in areas like the University of Ghana and Adabraka. The EPA is urging everyone to prioritize safety this Christmas. Vulnerable groups such as children, the elderly, and those with health conditions are advised to limit outdoor activities and wear pollution masks to protect themselves while enjoying the season. Clear Air reporter Michael Ashali has more in this report.
It's that familiar season of the year where the air is saturated with dust and dry. Like every year, the air quality during harmattan moves from moderate to hazardous levels. Starting from mid-December to peaking in late February, air quality watchers say this period impacts Ghana's air quality, which is currently in the red zone. Medics warn respiratory-related health problems will be high among those who will be exposed to the poor air quality. Data from the EPA shows air pollution is off the charts. At Adabraka and the University of Ghana, the air quality index has soared above 200, a stark, very unhealthy warning for everyone and especially risky for vulnerable groups. Across Accra, Breathe Accra's census report dangerously high PM 2.5 levels, with markets like Makola and Agbogbloshie blanketed in hazardous air. To put this in perspective, the WHO's recommended safe limit for PM 2.5 over 24 hours is 15 micrograms per meter cube. In some areas of Ghana, levels are hitting 15 times that, 4 times higher at minimum. This pollution isn't just dust. It's made up of fine particulate matter that can seep into your bloodstream and even reach your brain. Adding to the crisis is the relentless pumping of pollutants from vehicles and factories, compounding the already dire situation. The EPA has issued a notice cautioning the public about the dangerous air quality levels and advised protective masks and minimizing outdoor activities where possible. Vulnerable groups, including children, the elderly, and those with pre-existing conditions, are urged to take extra precautions. For Joy News, Michael Ashali.
Now let's speak to Dr. Sandra Kwati Owusu. She is a pediatric pulmonologist and a senior lecturer in the Department of Child School of Medicine and Dentistry, College of Health Science, KNUST. Doc, many thanks for joining us. And so, given the worsening air quality during this harmattan season, what are the specific health risks children face when exposed to unhealthy and very unhealthy air conditions?
Good morning, and thank you for having me. Yes, I agree with the EPA that this is a very important moment for us. Harmattan brings us close to very high levels of pollutants in the ambient air. So for children in particular, I mean, the whole of this week, I've had a lot of parents call me to ask, my child is coughing, my child is struggling to breathe, I can't breathe well. And the issue is that around this time, definitely because of the suspension, there's so much content of particulate matter. And once we breathe it in, you know, that also carries along with it bacteria and other organisms, viruses, that predispose children to getting upper respiratory tract infections. So the first one is that we would see a lot of upper respiratory tract infections around this time for children. But most of them will be self-limited. However, for a few children, especially those with underlying respiratory conditions, that could be of concern. So I think the message for most parents at this time is to be alert, especially for parents of children who have underlying respiratory conditions. And for that I mean, let's say asthma, already diagnosed with asthma, already diagnosed with lung disease of prematurity, which we call bronchopulmonary dysplasia. High levels of particulate matter could cause what we call in our, medical term, pulmonary exacerbation. That means worsening of symptoms. So I want to encourage all parents to be alert. If your child is already known with an underlying condition, this is a good time to visit your doctor or get a consult quickly. Stay on your prescribed medication. If the child shows worsening symptoms, it's important that you quickly consult the doctor who is looking after the child. They shouldn't run out of prescribed medications at this time. Okay. For children who are also not vulnerable, we would say a healthy child, they still can come down with upper respiratory tract infection. So as much as practicable, we can limit outdoor activities. But that is not to say they shouldn't exercise at all. If they need to go out in the sun, we need to keep them hydrated. Okay. And as EPA has suggested, they can put on nose mask that will limit how much pollution they are exposed to. So that would be a recommendation I would give.
Well, Doc, so the EPA said that it is quite concentrated in some particular parts of Accra. How long do I need to be exposed to this air? For example, if I visited Adabraka, do I have to just be there briefly and then I'll be exposed and I can be affected anyway, anyhow? Or despite it being concentrated in these two major parts of Accra, once I'm exposed, once I'm outdoor, I'm also quite exposed to this condition?
I think usually a brief exposure may not necessarily be harmful to many people. Usually it is the cumulative exposure. So people who are residents in those areas, maybe I would say stand a higher risk as opposed to maybe somebody who is just passing through the community. But in spite of that, I think we all need the knowledge, the awareness is important. Any precaution that we can take, wearing your nose mask would be advisable. And if you can avoid it, if you don't need to go there, then I would say please don't go there. But if you are a resident there, then you can limit your outdoor activity, and so that you would limit how much exposure you come into contact with. And I think even beyond the hot spots, I would say, generally when we step out, we're seeing that the whole atmosphere is very humid around this time, and there's a lot of particulate matter that is suspended. So literally all of us around this time stand the risk of being exposed to high level of pollutants. So we all need to be alert. We all need to protect ourselves. We all need to limit how much pollution we are exposed to, and as much as practicable, limit outdoor activity. Stay hydrated, because apart from being humid, the temperatures are also very, very high, and we may also stand the risk of being dehydrated and having heat stroke, especially also for people who are already known to be vulnerable. So if you are residents in a place that is a hotspot area for pollution, please be alert, please be aware. That is your home, that is your environment, and you don't have an alternative. Then avoid so much of the outdoor activity. Cover your nose as much as practicable if you are there. And then sometimes we also contribute to the sources of pollution. So indiscriminate burning of refuse and speeding in very dusty areas. We can all limit that so that we don't worsen the ambient air pollution in our immediate environment.
Doc, before I let you go, and finally, at what point should I be running to the hospital, myself or my child? Should I sneeze about 3 or 4 times, or shall I start coughing before I start running to the hospital, or there's no cause for alarm?
I don't think all of us need to run to the hospital. Generally, I would say the greater majority of the population, we are healthy. So we just need to hydrate ourselves. Our nostrils tend to get very dry, and the lining of our nostrils get broken, and that is when the microorganisms are able to move through. So I think staying hydrated, this is the time for our fruits and the vegetables that help to boost our immune system, but also look out for. If you are coughing, you don't necessarily need to run to the hospital. But if the cough becomes persistent, you are unable to breathe, and your respiratory rate is going much higher than it's normal with you, you have to really put in an effort to breathe. Then you need to go to the hospital immediately. And that will be the same for children as well. Okay. And I would say for children living with asthma in particular, if they have worsening symptoms. So for them, what the parents or the caregivers would see is, apart from the cough, they have exercise limitation. They cannot do the usual things that they are comfortable doing during the day, or during the night, they cough a lot, and then there's noise in their breath. That is a source of concern, and they need to go to a health professional immediately.
Dr. Sandra Kwarteng-Owusu, thank you so much, and Merry Christmas to you and your family, Doc.
Merry Christmas to you.